Okay, we are live.
Hello, everyone. Today we have another fresh dental shadowing session, and today we have Dr. George Galaz.
Good morning. All right, you guys ready? I can go. I can start.
Yeah.
All right. So good morning, guys. Thank you for having me. My name is Dr. Galaz. People call me Dr. George or Dr. G. Thank you for having me. I'm based out here in Katy, Texas. You have a nice, beautiful morning today, so I'm looking forward to talking with you guys. Thank you for having me. Normally what I do when I give this presentation is I do a quick poll of where everyone is at their state and college, whether they're freshmen, sophomore, juniors, and seniors. However, I understand there's a little bit of a delay with the feed and everything today, and everyone's kind of scattered all over the country. So instead of doing all that, I'm just going to ask, I guess, if anyone is here in Texas. Anyone? And then I'll see. I don't know if I'll be able to see the results of that poll, but if you are in Texas, hello, howdy, how's it going? All right. So I'm just going to assume there's somewhat of an even spread of freshmen, sophomores, juniors, and seniors here, all of you of which are pre-dental students. And I guess just before I get everything rolling over here, we can turn our attention to this picture, this graphic I have over here. It's an x-ray I took of a patient when, I guess around when I first started working. You can notice this is the lower right part of the mandible. You'll see a premolar and two molars. By the way, my volume's okay, my voice is okay, green light.
Sounds great.
Awesome. Okay. So you'll notice that there's these three teeth right here with these big black cutouts. You might guess already that that's huge amounts of decay. I believe this was a 15-year-old. Yeah, 15-year-old that I saw. And I was just impressed by the amount of decay here. This type of x-ray is called a periapical radiograph. Periapical because we try to aim along the whole length of the tooth from the very top all the way to the ends of the roots. And what I'm paying attention for here is not only the presence of decay, but how big is it? And if you can, some of you can notice the one in the middle, on the left side of the middle tooth, that huge cutout, that's decay, and it's really approximating the nerve canal. I don't have a pointer here. I'm on my iPad, apologies. But you can see how it's approaching that thin little inner black band, dark band in the middle. That's where the nerve is. So in that little space, we find nerves and blood vessels that all contribute to sensation and nutrients to the tooth and contribute towards the vitality of the tooth. So little fun facts over there to get your dental minds kind of going right there. All right, so a little about me before we continue. I was born in Santiago, Chile. And at around 3 years old, my old man, my dad, he made the call to move me, my mom, and himself all the way to Canada. We moved out to Calgary out west in the province of Alberta near the Rocky Mountains. It was gorgeous. And this kind of ties into how I got into dentistry, but I'll talk about that later. I played hockey since I was in fourth grade. I started playing soccer a lot, but I noticed all my buddies were playing hockey, and I told my dad, hey, man, I'd love to play this sport. I want to wear some knife boots and hold up a stick of lumber and hit people. It sounds cool. So he reluctantly helped pay for all that expensive equipment, and I'm still playing to this day. I've been playing guitar, electric guitar, for 8 years. Kind of picked that hobby up while I was in college. It used to be my sister's guitar. She let it collect a little bit of dust, and during my sophomore year, I found myself a little bored, and when I didn't feel like studying too much, I picked up guitar and started to teach myself. I'm not that good yet because I put my studies above everything, right? So it's just a little hobby to keep the hand skills up and just have some fun with music. I graduated class of 2020 last May of 2020 from the Texas A&M College of Dentistry, formerly known as Baylor College of Dentistry. So I was a part of that whole pandemic world shutdown shakeup thing that happened. In my fourth year, my last semester of dental school, everything just got put off. As many of you guys who may have, I'm not sure if any of you guys have graduated or not. I'm going to assume not, since we're all pre-dental. But for me, my last semester of dental school got cut short. I think it was the week before spring break in March of 2020, where I was gearing up to go home for spring break, but I was finishing up some appointments. And then we got the notification that the school is completely shut down and we're not going back, or we don't know when we will go back. So I go on my spring break, and 1 week turns into 2 weeks, turns into 4 weeks, turns into 3 months. About 3 months of being on a long spring break, of not knowing whether I'm graduating, am I going to finish seeing my patients. Am I going to get licensed? Is the Texas Dental Board going to approve licensure for our school? So there were a lot of unknowns. I had a job lined up. I didn't know if I was going to be able to start paying off loans. It was a nightmare. In the end, everything worked out though. I'm here, been practicing for just over a year, and life is so far pretty good. Not without its stresses, but it's pretty good. All right. So with that, I'd like to welcome all you guys to the profession. You guys might be pre-dental students, but you guys are endeavoring towards that dental aspect of your careers. So I consider you guys my colleagues, no matter whether you're a freshman, sophomore, junior, senior. You are my colleagues today. So welcome, and let's have some fun today. Here's a quick little video that you will enjoy. This was taken during my second year of dental school. I believe I'm holding up the camera. It's kind of a little trick shot here, but you'll see we're practicing giving anesthetic to each other. And I'll relieve the professor here to give him some instruction. I'm not sure if you guys can hear the audio, but just to give some commentary, we're giving anesthetic to my right inferior alveolar nerve. So she's being instructed, this is my good friend, Dr. Cosma. She's being instructed to deposit the anesthetic right once the needle hits bone. Very important to hit bone when you're delivering anesthetic, especially to the lower mandible. Well, obviously lower, but the mandible. Because if your needle is just hovering in no man's land, you might deposit anesthetic into the muscles of the cheek, which can in turn lead to muscle spasms or trouble opening and closing for the patient in the future. So very important to hit the bone. And then what you want to do is move back about 0.5 to 1 millimeter and then start injecting very, very slowly. The more slowly you deposit your anesthetic, the less painful, the more prolonged anesthesia you will have, the faster you develop. The faster you dispense the anesthetic, the more painful it can be, and the more risk of side effects and post-op complications such as ulcers or other sores and bleeds that can be caused. But yeah, so we numbed up my lower right inferior alveolar nerve, which meant I couldn't feel the right side of my tongue. My gums on the right side were numb, and my right half of my lower lip was all numb. It was super trippy. I was super freaked out. I'll play it again. I was super freaked out because I have no fillings in my mouth. The only dental treatment I've ever gotten were extractions of my wisdom teeth and some orthodontics, but I've never had gingivitis, never had need for fillings, root canals, or crowns. So this was the first time that I was consciously awake getting local anesthetic in my mouth, and I was freaking out. But we got to practice on each other. Everyone was super professional. It was super fun. So that's something you get to look forward to during your second year of dental school. All right. So I get this question asked a lot, especially from my friends that are not in dental, who are not dental professionals. I have a lot of friends that are engineers and they're photographers or something like that, but they're nothing to do with healthcare or dentistry. So they ask me, why do you like teeth so much, George? Like, what got you into this? What makes you want to spend hours upon hours breaking your back and looking at people's teeth and nasty mouths? So first of all, that's kind of a weird statement, but I guess it's understandable why people might ask this question. You guys might get this question a lot. What makes you want to look at teeth all day? Why do you like teeth? But I answer with this. What really got me into dentistry was, as I said before, I was born in Chile. We migrated to Canada out west. And my parents got jobs working for this custodial company, working as janitors, cleaning up office buildings, wherever the company was contracted to do so in the city. And this one night, they were assigned to clean a dental office within an office building in downtown Calgary, Alberta. And the dentist was staying late that night. I don't know what he was doing. Might have been like finishing up clinical notes or doing paperwork, billing, anything like that, I guess. But he met my parents, and he's never seen them before. So I guess he asked them where they're from and what brings them to Canada. I guess in their broken English, they explained how they have a 3-year-old son. They moved here to start a new life. You know, the whole immigration story, right? Going from weeds to rags, you know what I mean? And so, or rags to riches, I mean. And so he was kind of inspired by their story of traveling all the way from Chile to Canada, kind of hopping over the United States and going into Canada. And so he offered to give me, my parents, free checkups, free cleanings for like 1 to 2 years while we got on our feet and figured things out, you know, because we're complete strangers to this whole country, not knowing what anything is, especially not knowing English. So when I found this story out when I was about 5 or 6 years old, I was like, I would love to do the same thing. I was kind of touched by that story. I had no idea. So his name is Dr. Chan. I'm still in contact with him. He practices in Calgary, Alberta. I met up with him again. I think like maybe 2 or 3 years ago. He saw me for the first time in years, and it was a cool experience. But the message, what I'm trying to give from this is that we're in a very unique position here as pre-dental professionals and as dental professionals to get involved within our community and establish a sense of being friendly neighbors, loving neighbors, caring neighbors. And we're in a unique position as well to build long-lasting relationships with the people we work with, meaning our front desk, our classmates, our hygiene staff, our patients especially. The doctor I currently work with, he's been seeing patients since they were kids, and now they're all grown up with kids of their own. So that's something that's really exciting and something to look forward to. And the main message that I'm trying to instill kind of throughout my presentation today as I talk to you guys is to give back and pay it forward. Our profession is something that is pretty well tailored and is pretty well stationed and set up to do wonderful things with the financial freedoms that we are allowed as being dentists and any other specialty within our profession. Any questions so far? And I'll give a little bit of a second for the delay here. Or we can do questions at the end. Okay. So moving on with the slide, what makes a great dental school applicant? And I'm sure we can get to questions at the very end. Don't worry about it. But let's get the main meat out of the way. Many of you might already know, or those of you who are freshmen, sophomores who are starting to figure this out, the minimum that you want to kind of shoot for is a 21 just to be competitive for a DAT score and a GPA of 3.5. Granted, it's kind of a moving scale, a moving target, especially with each year. The averages are changing, but for the most part, these are the numbers you kind of want to shoot for. And the trends I've noticed are if your DAT is kind of on the lower side, your GPA has to be on the higher side, and vice versa, kind of to just counteract. The main goal of these numbers is for the computer software and the algorithm that these dental schools use is just to help gauge which students should be granted an interview. Not so much for should they be accepted, just should they be given an interview? Should we be given interest to these students? Also, that something that is kind of looked over, a lot of students look for at the very last minute, is a letter of recommendation. If you're a freshman or a sophomore, I want you to really get focused on this part. Make friends with your professors, with your directors of curriculum, with your deans and all that. Get them to know you and let them know what you're all about and what your goals are. And instill a little dialogue and just get a small little relationship going throughout the semester, maybe throughout your college career. And then eventually, as they get to know you and they can vouch for you through a letter of recommendation, something that can be very personalized and something that dental schools do not take very lightly. The next one is community service. My girlfriend is currently applying to dental school. She just graduated from dental hygiene school, but she decided to go dental. And so she's trying to figure out what other community service she can do. And I said, community service, the title doesn't have community dental service. It's community service, meaning what you choose to do does not have to be within dental. You don't have to be at a dental office. You don't have to be at a dental clinic. Go to a food bank. Go to a homeless shelter. Go to a soup kitchen. Do anything that's involved within your community. As I said again, the dental profession is set up in a unique position to give back, pay it forward, and get involved with your neighbors and with your community. It doesn't have to be strictly mouth and oral health related. So get out there, get creative. There's lots of things that you can do. At the bottom is hand skills. It's not that important to be granted admission into a dental school. Like, how are you Picasso with your hands? No. I definitely was not. Hand skills is something that can always be taught with practice and with muscle memory. But there are some things that sometimes they do ask. In my interview, they asked me, have you done anything with your hands to help prepare you for the hand skill rigors of dental school? And I was like, oh man. But however, at the time, like I said, I was playing guitar. So I made up a quick little story, a little narrative where I picked up guitar for the first time, taught myself, and using some limb independence, learning with my left hand, my non-dominant hand, moving along the fretboard, And it's just something to say, but it doesn't have to be an instrument. An instrument is kind of a good narrative that you can give. But if you're a painter or some sort of artist or a sculptor, or you have a job in, I don't know, construction, anything that uses your hands, you can use as a narrative should they ask that question for you. But the main underlying point of all this is they put all this together, jumble it up, grant you an invitation for an interview, and then they want to get to know the bottom of it. Basically, who are you as an individual inside and outside the professional setting? So they know who you are on paper, but what are you like in front of another professional? And then they're going to be asking you questions about what you do outside of school. They want to know the whole background, the whole color of you, what makes up your whole spectrum and your whole personality. Because dental schools know, obviously, it's super competitive, and they want to be accepting the right caliber of professional. All right. So this over here is a small little snippet video of something I did my second year of dental school. Second year of dental school is super exciting. So this one we were preparing to do an immediate denture on our mannequins. Everything is mannequin based in second year. And what I did here was I was designing teeth and preparing to position teeth for a denture. Excuse me. You'll notice the paint is wax that we melt and we apply to the stone cast and hardens. We start to carve it out. We place our teeth in there. These are plastic denture teeth, specifically for dentures. And with this upper and lower arch, we're able to position everything so we can kind of predict the smile line, the pathway of speech. And this machine, or this little contraption I'm using, is called an articulator. And what it does, it helps to mimic where if we are accurate in our positioning of teeth, and we can move the jaw from side to side, backwards and forwards, inside and out, and all that to try and make a balanced occlusion or a balanced bite. Very important when we're treatment planning is making sure at the end everything is in harmony and equilibrium in terms of occlusion or bite. All right. So once you're in the application cycle, you'll either end up in one or two camps. Either I got into dental school or I did not get into dental school. I was in the camp where I did not get accepted in my first attempt. So I was having to do quite a bit of soul searching. So I was like, man, what do I do now? I've been wanting to do this since I was like 6-7 years old. I don't have a backup plan. This is what I want to do. I had to do some soul searching. I had to self-evaluate my goals and my motives and stay true to myself and really ask myself and dig deep. Is this something I will really want to pursue? And how bad do I want this? And then I have to ask myself, what are my shortcomings and how can I better myself? I'm pretty sure the obvious at the time was I need to get my GPA up and more than likely my DAT. The DAT is no walk in the park. And my first time, I didn't really know what I was doing, how I was studying, how the best way to study for the DAT. I was kind of just lost on a whim and doing everything on my own. I wasn't studying with other people. I was doing everything lone wolf style, and that probably was not the best strategy. What some people do is they consider either doing a master's degree or a post-baccalaureate program, something I'll get into on the next slide. But for here, when you ask yourself these questions, these self-evaluation questions, and you land in, I want to be a dental professional, I want to help people, I want to be involved in my community, I want to give back and pay it forward, then apply again and don't you dare give up. Lots of people do not get in on the first try, don't get on the second try, don't get in on the third try, but they keep pushing forward. What's important is if you do not get in, make yourself better for the next run so your resume and your application isn't the same stale submission. Improve in some aspects, and not only your DAT and your GPA, but do some community service. Go for those mission trips. Those really highlight what you can do and what you're all about. Just make some tweaks to here and there so it's not the same application. Like that saying goes, if you kind of stumbling on it, but if you expect to do the same thing over and over and get the same results, that's the definition of madness. That's not the exact quote, but all right. And here on the left-hand side, here is a picture of, or not a picture, a video snapshot that I did of a 3D x-ray on a CBCT, a cone beam computed tomography shot of a patient. So I narrowed it down so the field of focus was in their maxilla and in the mandible. Here what I was doing was I was experimenting with the software, but I was planning up for some extractions and getting to know some root canal anatomy of a premolar prior to starting a root canal. What's really cool about these 3D shots is that it gives us the total spatial environment, so we can do precise measurements of how long a root canal is, where the roots are positioned to a nerve. And why is that important? Why do I care about root position to a nerve? For example, when you're extracting wisdom teeth, many times, or your oral surgeon or your dentist will be taking these shots to see where the inferior alveolar nerve is in proximity to the roots. Because during extraction, if you traumatize the root, the nerve, apologies, you can cause prolonged anesthesia or paresthesia, meaning total numbness of the area, even after the anesthetic has worn off. So these 3D shots give us the most accurate ways to measure and plan our treatments for extractions, root canals, implants, implant-supported dentures, anything surgical. This is kind of what we want to be doing, given a total spatial awareness and spatial anatomy, so we can do precise measurements and really calculate the risks and rewards of certain treatments. Really, really cool stuff. All right. So I mentioned a post-baccalaureate program before in the just recent slide. Some people go on to do a master's degree after they graduate, or this is another option, a post-baccalaureate program. So at the time, I think I was taking my organic chemistry 2 class, and I got an email from one of the Texas schools, Texas A&M College of Dentistry. They sent me an email saying, "Hey, George, we know we didn't accept you for this coming cycle, but we really want you to take a look at this other program we have. It's their post-baccalaureate program from Texas A&M College of Dentistry. The link is down there for anyone who's based in Texas. Anyone based in Texas, take a screenshot of this, or you can contact me and I'll send you the link, or you can just do a Google search, Texas A&M post-bac program." And what it is basically, I'll play this video as I talk. It's basically a program for those who are seeking alternative ways to apply for dental school. Many times these are curated towards first generation college students, those with extenuating circumstances. Maybe they're a single parent, or none of their family members have ever been to college, or you're a minority working in an underserved, dentally served community. There's all these sorts of criteria that you might qualify for this program. And what I would encourage you to do is to research your dental schools and see if they offer anything similar. And the details of this particular program that I took were that it consisted of doing 3 parts. The first part was a 6-week summer session at the dental school, doing preclinical courses, basically, of what a first-year dental student might do. So we get a super crash course in first-year dental school, and we have to pass. I believe we have to make, I don't remember what the passing criteria were, but it was a super grind. Imagine going through D1 first-year dental school, but getting all that crash course into 6 weeks. It was quite a bit. So there's 6 weeks of doing summer classes of I'll call it pre-D1 courses. And then we had to do a fall and a spring semester at the University of Texas of Dallas. Why that particular school? Because it has a really, really rigorous science program. So we were doing higher level science courses for a fall and a spring semester. And I think the minimum GPA we had to make was like a 3.4 or a 3.5. After doing those semesters at UT Dallas, we went back to the dental school for another 4 weeks of summer crash courses. We would do physiology, we would do head and neck anatomy, we would do histology, dental anatomy, anything and everything that a D1 would need in order to thrive in their first year of dental school. So after the first 6 weeks of summer at the dental school, the 2 semesters at the university, and then the final 4 weeks at the dental school, we would do a wrap-up presentation on a research project around anything we wanted that was dental related. And then there was this graduation ceremony where we get our admission to dental school, a little certificate that says you are now admitted to the Texas A&M College of Dentistry. So this is just this one program for this one school. But I would not be surprised if there are many other schools out there offering a program similar like this, especially for those that are of minorities or that are first generation students. Research out there and see what your local school and your state offers. And I wouldn't be surprised if this is a thing. Now, I do have other friends that did not qualify for this program. They only accept 10 students out of thousands of applicants. And this was my route of getting in. I applied, I got an interview, they accepted me into the program. It was a big grind, but again, it's only 10 students. So what happens for those who don't get in? I would advise for you guys to go pursue a master's degree after you graduate. If you're already a senior and you've applied and you haven't gotten admission, try a master's degree or a similar post-baccalaureate program. At the end of the presentation, you'll have my contact information if you want any more information on this, because I could talk about this for days. All right. On the other hand, you might have gotten accepted on your first or second or third attempt, and heck yeah, that's awesome. Now it's time to celebrate your victory. You put in a lot of blood, sweat, and tears, time putting off with your friends and family to study and prepare for your DAT, get the best GPA you could. You got an interview, you nailed it, and you got in. So awesome. But now it's kind of like, what do I do in order to get into dental school? There's a second wave of freak out where you're like, wow, I'm in dental school, but now what? How do I handle this? This is a whole other monster I was not even prepared for, you know? So there's some advice I can give for incoming D1 students that have been accepted. I want you to be a team player and get involved within your class and your school. You might have heard that even while you're in college, but this is really important in dental school because your class is small. It's maybe around 100 students, maybe a little bit north of that. But you have a small class that you're going to be with them every day and every night, studying, going to classes, going to labs, going to lectures, going to appointments with. So it's very important to get involved within your class and not be the lone wolf that does everything on their own. Cool if you do it, but I wouldn't advise to do it 100% of the time. Find ways to make those familial connections, because the friends you make in dental school are literally for life. They are for life. My friends from high school, my friends from college, I've disconnected with a few of them. But in dental school, we're all still in touch. It's only been a year since we graduated, but we're all still in touch with each other because you are very close with those 100 people. So by that, I mean, get involved with organizations, share your notes, make study groups. I want you to get involved in your class events. Sometimes there's going to be the Hispanic Dental Association, the Asian American Student Association. Get involved, go to all those events, you get free food. So that was always an incentive. And you meet a lot of people, you meet your faculty, and just become a part of a great student body of dental professionals. It's a great way to network and get in touch with even more people and kind of build a web of connections. So it's a great way to get through dental school. Contact the financial aid office at the dental school. Why? Because more than likely, the majority of us, just like I did, will be taking out loans. And we all know the big story behind loans, how it's this big monster that is like draining down thunder and lightning upon us throughout our careers. And one thing about loans is only borrow within your means with what you need. Don't go and get that fancy apartment or lease that new car. Live within your means and only borrow exactly what you need, because interest rates are not going down. They're going up every year. And there's really not much to do about it except to just play ball. So be as smart as you can financially. A bunch of my buddies, they took trips during dental school with their loan money. They'd go to Europe, they go to Mexico, they go to South America, they go to Asia on their dental school loan money. And I was like, what are you guys doing? Because you got to pay this money back with interest. So I only borrow within your means and just be smart with your money. Not saying to not celebrate your victories. Go and splurge every now and then, but don't live like a king. Remember, you are a dental student. Don't live like a king or a queen. You are in dental school. All right. Next one is be ready to make tweaks to your study routine. Yeah, well, you studied very hard. You studied very well and intelligently in college, but that doesn't always necessarily translate to dental school. Sometimes it does, but more than likely there are some tweaks that you have to make here and there, whether it's the amount of time that you invest into certain subjects, because you think you're taking how many hours in your first year of dental school, but it's almost double or triple what you take in a regular semester of college. So think of how many hours you're taking right now per semester, and then multiply that by 2 or 3. And that is 1 semester of dental school. So it's insane the amount of hours of didactic courses you're taking. So just be prepared to make some tweaks. You're going to have ups and downs in terms of the grades, but just be able to adapt and make good contacts within your dental school class and just make some tweaks to each other and have fun studying, man. At the end of the day, have fun with everything. You are one of 100 people that applied and got into dental school, and you made it. And now it's time to run with it, roll with it, and make the most you can out of it, because it's a once in a lifetime opportunity. I truly believe that. All right. And over here, this is a baby tooth extraction I did. I think it was 1 or 2 months ago. I'll play it a couple times here. You'll notice the big gaping hole in there. Huge cavity, huge cavity. This was the son, actually, of one of my dental assistants. She came to me and said, "Hey, doc, my his tooth has been bothering him for a little bit, and wondering what we can do. I think it's loose. I think it's a baby tooth." So I told her to bring her son in, and definitely noticed the big gaping hole. It's obvious what's hurting him. And you can notice the tissue there, that red tissue on the underside of that crown. That's inflamed pulp tissue, inflamed blood vessels and nerves. We call it a pulp polyp. Basically, it's granulation infected tissue. And there's no roots because the adult tooth underneath resorbed all the roots, which is what normally happens during aging of children. And so we took this big bad boy out and gave him no antibiotics. No, we just told him to do salt water rinses, and he was all set. He was totally fine the next day, free of pain, free of everything. He's hanging out. He's doing real good. All right. So what's the life of a dental student? Super exciting. It can be a drag at times, but that's life. And you just got to roll with the punches and get up and just keep moving forward, as cliche as that sounds. So for a first-year dental student, you are a D1. What are you going to be doing? The slide pretty much says it. You're going to be studying and studying. Find some time to eat and sleep. Hopefully sleep a lot. Sleep as much as you can within your means. Don't oversleep. And then eat healthy. I can't stress that enough. I definitely let myself go a little bit. And I splurged on the junk food because I'm staying up super late. There are those who are pulling all-nighters for almost every exam. I remember my roommate. Oh, man, he annoyed me so much. So this guy is super intelligent, super intelligent. But because he knew he was intelligent, he was always studying the night before for every exam. And I could not wrap my mind around this. None of us in our class could wrap our minds around this. Maybe you're like this, and man, I'm super jealous. Like, he would study the night before, get like 100, and me, I'm studying like a week in advance, even if that, maybe 3 days in advance, just because of all the timing, and maybe to get a B, or even a C. So I don't know how you did it, but yeah, for us average Joes, we're going to be studying, eat, sleep, study. Your first year, nothing but didactic courses. And you will be going into a lab for learning dental anatomy. You'll be learning how to do wax carvings of teeth to learn dental anatomy. It's a really cool way of learning tooth morphology and function and physiology of teeth. And it comes in handy when you're doing fillings and crowns and everything. Cool, so that's D1. Lots to look forward to. D2 year, a little bit of a step up in terms of a lot less studying. I'll say a lot less studying. You're still studying a lot, but it's significantly less than your first year. But you're getting your hands dirty in a dental lab. And basically, you're going to be trained on how to be a lab technician, essentially. You're going to be learning how to make crowns out of gold, out of porcelain. You're going to be learning how to make bridges out of gold and porcelain. You're going to be learning how to do root canals on a plastic mannequin tooth, learning how to do fillings, learning how to do maybe even place implants. The dental school curriculums are changing, and they're more than likely going to be allowing you guys to start learning how to practice place implants, maybe on a model arch, model mouth. I didn't get that chance, but I'm hearing some classes are slowly getting into that kind of curriculum. What else will you guys be doing? Oh, you'll be learning to use digital scanners, for the iTero scanner that Invisalign uses, using that to help design crowns, or maybe even a CEREC scanning machine to learn how to make same-day crowns in the same day of an appointment. So it's a lot of lab work. You learn to appreciate what the lab technicians do. So next time you go and you scroll through Instagram and you notice a dentist showing off these nice veneers or beautiful smile designs, it's not all the dentist. Behind the scenes is a talented lab technician making these crowns and these prosthetic teeth. So you gain a great appreciation during your second year of dental school. Third year is you're getting to know what it's like to work on a living, breathing human being. You take everything you learned your first and second year, and you're given your first patient. More than likely, they're going to be a denture patient, something really easy that they're probably already without teeth. and all you got to do is design a denture. I say all you got to do, but you will have the skills ready by D3 to handle a live patient, meaning you're going to have to review medical history, their social history, their dental history, get all the information you can about your patient so you can adequately treatment plan, provide any medications such as painkillers or antibiotics if needed, and provide holistic care to your patient. And more than likely, you will be using the knowledge of a fourth-year dental student to guide you through your first few appointments on how the protocols of your school are working. Which kind of drives me to another point, actually. If you're a first-year dental student, I want you to get to know the second-year dental students. If you're a second-year dental student, get to know the third year, so on and so forth. Why? Because those upperclassmen, they will have been in your shoes, and they will have gone through the aches, groans, and pains of everything, and they will be able to guide you and show you little cheat sheets or little hacks on how to get through your year or your semester. When you finally arrive at fourth year of dental school, wow, what a finish line, man. You're going to want to just finish up any requirements. You're going to have to do so many extractions, so many crowns, so many fillings. I remember at my school, we needed about 100 extractions just to make a C in that part of the course. So it was wild. You're going to want to refine your skills. See if you can get into more cosmetic treatment. Try and propose those treatments to your patients and get as much out of it as you can, and nitpick the faculty and their knowledge of what they have to share with you. Because sooner or later, you're going to be out in the real world by yourself with your own dental license, responsible for the well-being of a patient in your dental chair. And then you're going to want to finish off real strong with finishing and passing your board exam. Out here in Texas and the states to the west of us, we take the REB, Western Regional Examination Board. I forget the names of others. I believe there's the ADEC exam, or I forget the other ones. But yes, if you're out in New York or you're in Florida or something like that, you'll be taking a different exam. And every year the laws are changing, and the board exams, they modify with state laws. But those are the exams that you're going to want to be making sure you're passing with flying colors, because that's what's holding you back from getting your license. And then there's a whole other web of a to-do list in order to get your DEA license and get everything board certified. But you'll get there when you get there. Right now, just get worried on getting into dental school and shining through your first year of school. All right. Was a third year? I want to say I was a third year dental student, but I was doing a wisdom tooth extraction. Oops. And it took a little bit longer than I had wanted. And this is what happens when you rush and when you let things get to you. The tooth broke in half. I was not anticipating that. This was a big learning experience for me. So the tooth broke off and the root was left behind, buried in the bone. I was like, how do I get this out now, man? This patient has been here for maybe an hour in the chair trying to get this wisdom tooth out. So if I remember, the oral surgeon came and helped me out. He did some cool surgical techniques to dig out this root. And wow, what a procedure. Super, super fun. That's something I think I did in third year. So really, really cool stuff to look forward to. All right. So I've been working for about a year and over 2 months. And what a whirlwind it's been. It's been super blessing. It's been super humbling. It's been an amazing experience. So when I moved to Texas in 2008, found a dentist here like 10 minutes from me, and I networked with him, and throughout college and dental school, I was shadowing him at his office during my Thanksgiving breaks, during my Christmas breaks, summer breaks. Any break I got from school, I came home to shadow and just learn the business, learn what it meant to be a professional in a private practice setting. I knew I needed to find a job at some point. So I was kind of investing in an early relationship with this doctor, who happened to be my own dentist. So it was cool. We built a cool relationship together. He's been a longtime friend and mentor of mine. He wrote a wonderful letter of recommendation for me. And that's actually a piece of advice. Go, if you like your dentist, make sure you're shadowing at their office. Let them know what you're doing, and maybe they can write a really colorful, glowing letter of recommendation for you. Anywho, when I was fixing to graduate, I said, hey, man, I'm looking for a job. And he said, you're going to come work here? Like, duh. He said, I don't need to see a resume. I don't need to see what your grades were or what you did. Just graduate, get your credentials, get your license, and all the paperwork done. and come work here for me. So that's what I've been doing. He lives 10 minutes down the road from my high school that I went to. And I've been working with him for just over a year. Really cool guy. His name is Dr. Arnaud Debuel. Really fantastic guy. He graduated in 2004 from the dental school here in Houston. Really tall dude, but he's awesome. All right. And the learning really begins after dental school. Dental school will train you to be competent enough to get your license. But man, is there so much more to learn. You can't learn all of dentistry in the span of 4 years, especially when only about 2 years are spent on practicing on patients. There's a whole lot more to learn. Implants, cosmetics, tissue health, patient communication is one that is super important, that you get minimal practice in school because you're just fed patients who are more than likely going to accept treatment. Here, when you're in the business of dentistry, you got to sell what treatment you're wanting to propose and recommend that you feel that your patient needs and deserves to optimize their oral health. And sometimes they need some convincing. And when you look young like me with no gray hairs or anything like that, it's kind of hard, you know? So experience and learning never stops. My philosophy around being a dentist is that it's all a collaborative effort, one big moving, well-oiled machine of a collaborative effort between the patients, the hygienists, the assistants, and the front desk staff to all coordinate and do this kind of well-orchestrated dance in order to fulfill the needs of a patient so they can optimize their oral health. It's something that is very tricky to do. Dental school does not show you how much effort this really takes because they just feed you patients so you can try and meet your requirements. But out in the real world, after you graduate, it's a whole other ball game, and you do a whole lot of learning on your feet. And there's a lot of story-driven narratives you have to come up with on the spot in order to try and be productive for that day. And as I said, with all the learning that there is, I decided to join a few study clubs. There might be some in your local municipality or your local state that do their own version of study clubs. We have the Greater Houston Dental Society here, and my boss has been a part of what's called the Seattle Study Club. And basically they get together once a month and they look at cases and they get together in groups and they huddle up together on how would you handle that implant, or how would you have handled this aesthetic case with all these broken front teeth? What would you have done first? Orthodontics? Would you have done the fillings first, or do you even send for a root canal? What do you do? So we all come up with a treatment plan in step-by-step order, and then we all compare, and you realize there's way more than one way to skin a cat. So many ways to do dentistry, so many ways to solve the puzzle, so many ways to get to the end goal. And it's really fascinating to pick the brains of all the other experts. I also joined the Spear Study Club as a kind of addendum, kind of as an adjunctive way to supplement my learning when I'm not working on the weekends. We also get together once a month at some Italian restaurant called Maggiano's, and we do the same thing. We huddle up and we treatment plan and we look at cases, and we learn a lot. And again, now that I've been working for a year, I'm trying to catch up on giving back and paying it forward. I kind of lagged on it, but with COVID and everything, all the events keep getting shut down. But for those of you in Texas, try and catch me at the next Texas Mission of Mercy event. I love doing those. I did those throughout college and throughout dental school. All right, and 3 principles to live by. Always go in head first. That doesn't mean going blindly. It means go in head first with your best foot forward, the best possible attitude you have, and give it your all, which means never give 99%. Always give 100%. We have a responsibility, and we swear an oath to these patients that we are going to put their well-being, their lives, their health, their everything above all else. Not for personal gain. We never give 99%. We give 100% to our patients, to our profession, to our staff, to ourselves, and pay it forward. Over here, you will see I think this was my 4th year of dental school during spring break. No, sorry, 3rd year of dental school, spring break. Spent the week in Tyler, Texas, giving free treatment to the people here of the community at, I believe this was a dental hygiene school in the area. We spent the whole week doing extractions, doing fillings, doing cleanings, and man, what a grind. What a super fulfilling. Something that is very unique in this profession. All right. So now with all that, I know I gave a lot of info. I hope I went at a semi-good pace. I hope you guys got good audio. But any questions? Here you can see my class, or the few of my class. These are my best friends from dental school. And because of COVID, we didn't do a big class picture. So in our own time, after we got our robe and cap and everything, we got together and we took a picture together to celebrate graduating somewhat.
First, I just want to thank you for a very informative presentation.
Sure, you're welcome.
Regarding questions, my first question is personally making the change from like post-bac or undergrad to dental school. What were some of the challenges and adaptations you had to make to, better suit the environment you were in?
Okay, that's an awesome question. College, think of it as studying light, like a light version of studying, because dental school think of it as the big leagues, especially in your first year of dental school. You will have classes on top of classes. You're at school from 8 to 5. It's basically a full-time job. And that was a really hard transition because in college, you kind of get a lot of gaps in your schedule at times. Like you have a class here and there, you can go to lunch, you can go work out. When you're in dental school, your first year, you're there from 8 to 5, nonstop, mandatory class. They take attendance. It's part of your grade. So that was something I had to adapt myself to a lot. And it was a big culture shock. Everyone like walked out of their first day of school with like a big headache, like, oh my God, all this information. But what really helped me was breaking it down into chunks. So I'm like, okay, my first morning consists of these few classes, which means I'm probably going to have a test for these classes first. And in the end, what I did was I got my syllabus, put it all down on one big whiteboard calendar, and I charted down all the quizzes and all my tests and all evaluations and examinations that I have for that first chunk of my semester. Because by laying it out, you can see what classes I have time to divvy up to. You won't have time to study for every class. If you're used to studying a week or two for an exam, that's not going to happen anymore. You're going to have time to catch up for your lectures and maybe have 2 days of solid studying, of actual studying, not just going through the lecture and writing notes, but actually sitting down and studying. Maybe have 2 days. Definitely, you might find yourself studying solidly of actual studying for 1 day before your exam. But it gets hard at first. They definitely do ease you into it, especially at the school I went to. I don't know, curriculums are always changing, but what helped me was to divvy it up into chunks, get a group of no more than 2 to 3, large groups are not the best, 2 to 3 like-minded thinking people, get together and go through the grind. But the main thing is just to plan out and recognize that you have to really manage your time for which classes deserve what kind of attention for those upcoming exams. Really good question.
Oh, wow. 1 to 2 days to study for an exam seems a little intimidating, but I guess everyone has to go through it.
Everyone goes through it.
Yeah. My second question is regarding like dental assisting. If possible, would you recommend pre-dental students like engage as a dental assistant to learn about dentistry and some of like the practices?
I would say that's not a bad idea. It doesn't hurt. I do not see it as a negative. I do see it as something positive that you could definitely do. Get to learn the instruments, get to learn the types of procedures. And more than that, pay attention to how the doctor is communicating with the patient. That's a skill that is very, very hard to accomplish and very much underlooked and underappreciated at times. I didn't fully appreciate patient communication until I graduated and started working for real. So more than just paying attention to the procedures, which is all cool and everything, but kind of dig into how they're talking and how they're trying to, a lot of the times, I hate to say it, but we have to convince patients a lot of the time to take that x-ray or to do that filling or to go get that root canal or extraction. So watch the way they're communicating and the way they form their team dynamic with their office and with their staff. It's something really cool. So dental assisting gives you a bird's eye view, a front row seat to all the action. So definitely do it. But by no means is it necessary, but it's definitely a plus.
That's great to hear. That's all the questions I have for today.
Beautiful.
I want to thank you again for coming on and giving this presentation. We really appreciate it. I'm sure the people watching share the same opinion.
Yes, sir. Thank you so much. Take care, guys. Thank you so much for having me. If you guys have any questions, here's my email address, my Instagram handle. We can get in touch and touch bases. Should you not have thought of a question yet, you can always touch base later. Thanks, guys.
Thank you.
All right, take care.